name's Morgan. I'm going to be performing a head, ear, eyes, nose, and throat assessment today. To start, I'm going to have my cameraman go around the room to show that there are no cheat sheets or anything written on the walls. Okay, upon entering my room, I would provide for privacy. I would wash my hands. I would check the patient's chart. And I would introduce myself, tell them, hi, I'm Morgan. I'm going to do an assessment on you today. Can you tell me your first and last name and your date of birth, please?
Martin Johan, 02-27-98.
Perfect. And to start, I'm going to do my subjective questions first, get a health history on you. After that, we'll go into the physical assessment. How's that sound?
Beautiful.
Okay, we'll start with your head. Do you have any experience any frequent headaches? Do you have any neck pain? Do you have any trouble with range of motion with your neck? And have you had any histories with neck surgery or head surgeries? Okay, and then let's go with your eyes. Have you been to the eye doctor lately? And how did they do a Snellen chart on you? How did that go?
20/20 vision.
So no contacts or anything? So right now I'd say that since he did do that Snellen test, his cranial number 2 is intact, his optic nerve. Let's move on. And no discharge from your eye or any eye discomfort? Okay, ears. Do you have any problems hearing? Any discharge from the ears? And any frequent ear infections? Okay, how about nose? Any difficulty smelling? And since he had no difficulty smelling, we'll say cranial nerve number 1 is intact. If he said he did have difficulty smelling, I'd perform a smell test at this point. Moving on to your mouth. Have you been to the dentist recently? Have you had any major dental work or wisdom teeth removal? Do you have any bleeding gums or chipped teeth or anything like that? And do you smoke? Okay, my assessment for objective is done, and now I'm going to move on to a physical exam on you. To start, I'm just going to say that, can you tell me what the year is?
2020.
And can you tell me where you are today?
Baker College.
And what time is it about?
I want to say noon. I don't have a watch on me, so.
Close enough, it's about lunchtime. Okay, so my person is oriented to person, place, and time, times 3. He is dressed appropriately for the weather and for the season. His mood is a normal affect. His posture is nice and erect. I don't see any signs of not being able to know where he's at. He was able to answer all my questions properly. So I'm going to go ahead and begin, if you don't mind. We'll start with your head. Okay, I'm going to first note that his hair is nice and full. I don't feel any masses or lesions on his head. His hair texture is nice and thick. I don't see any spots of thinning or baldness. I'm going to just check his temperature. He is warm to the touch, dry, not sweaty. And then I'm just going to check his skin turgor. It's good. He's nice and hydrated. Moving on, I'm going to start, I'm going to palpate your lymph nodes for you. First, we have your preauricular, then we have your postauricular, we have your occipital, we have your tonsillar, your submandibular, and your submental. And then we'll move on to the superficial cervical. And then if you want to turn your head for me this way, we got deep cervical on each side. If you want to turn your head this way. Okay, and then we have posterior cervical. And then can you shrug up like this for me? And then we got your supraclavicular. I wasn't able to palpate any lymph nodes, so that's normal findings. Now I'm going to move on to testing your sinuses. When I push down, just tell me if you feel any pain or pressure. Well, you will feel pressure, but any pain, let me know. Anything?
No.
And how about on your frontal? Okay, I'm going to go ahead and test your TMJ if you want to open up and then close. I don't hear any popping sound. He was able to open and close with no problem. Next, I'm going to do a hard and soft test on your face for you. I'm going to put either hard or soft. I want you to tell me which it is and where you felt it on your face.
Soft on my forehead.
Okay.
Sharp on my left cheek. Sharp on my right cheek. And then soft on my chin.
Perfect. That tells me that cranial nerve number 5 is intact. Next, I'm going to move on to your facial sensations. So can you puff out your cheeks for me? Can you raise your eyebrows? Can you smile? Can you frown? Okay, cranial nerve number 7 is intact. We'll move on to your eyes next. As I'm looking at the eyes and the eyebrows, I can see that the hair is evenly distributed throughout. I don't see any issues there. If you want to pull down on your eyes for me, his conjunctiva is pink and moist. His scleras are nice and white. Do you want to pull up on this? Thank you. I don't notice any opacities of the corneas, so that's good, and I don't see any discharge coming from the eye. Next, I'm going to perform a test on you to see how your eyes react to the light. Okay, your eyes did react to the light. They were both equal in size. I would grade your pupil size. I would say they're about a 3 right now. And then I'm going to go ahead and perform my 6 cardinal gauges test on you. So if you just want to focus on my pen and follow it only with your eyes, not your neck. Okay, and if you just want to look on this back wall for me, and then when I bring the pen in, focus right in on the pen. Okay, perfect. So your eyes met Perla, they accommodated to light, and they were equal and reactive, and they accommodated directly and consensively. And after doing that test, cranial nerves number 3, 4, and 6 are intact. So now I move on to your ears. As I'm looking at your ears, they are normal for your head size. I can see that they are in line with the outer canvas of your eye. So first I am going to go ahead and push in on your tragus. I'm going to pull back on your pinna, and then I'm going to push on your mastoid process. After that, I'm just going to go ahead and take a little look inside your ears for my light, okay? Okay, as I'm looking in the ear, I'm noticing very little cerumen, if any, which is normal. I'm not seeing any masses or any foreign objects. Everything's nice and pink, and there's no drainage in the ears. And next, I'm going to perform a hearing test on you. So I'm going to make a noise behind you, and you just tell me what side you heard it on.
Okay. Left.
Okay.
Right.
Okay, and if you want to go ahead and stand up for me, and if you close your eyes for me, this is the Romberg test. He has a little bit of swing, which is normal. Okay, you can go ahead and open up and sit down. So this tells me that cranial nerve number 8 is intact. Next, I'm going to have you push against my resistance up on your shoulders for me. And then can you push into my hand? And then on the other side. That tells me that cranial nerve number 11 is intact. Now I'm going to move on to your nose. As I'm looking at your nose, it's symmetrical. It's a normal size for your head shape and size of your body. I don't see any drainage coming from it, so if you don't mind, I'm going to look up it now, make sure everything's good. The turbinates are pink and moist. The septum is not deviated. I don't see anything up there, any foreign objects. If you can go ahead and we'll check the patency of your nose. Can you plug one side for me and sniff in? And then can you plug the other side for me and sniff in? Perfect. Okay, next I'm going to move on to your mouth. As I'm looking at your mouth, I can see that your lips are pink and moist. I don't see any cracks or bleeding. If you just want to open up your mouth for me, I'm going to take a look around. As I'm looking, I can see that the buccal mucosa is pink and moist. I can see the pharyngeal wall is intact. His tonsils, I grade about a +1. Can you just say ah again for me one more time? Perfect. His tongue is midline, and then if you can go ahead and pull down so I can look at your gums. Okay, and then on the top, gums are nice and pink, no sign of bleeding, no cracked or chipped teeth. Can you go ahead and lift up your head for me, and then swallow? And then can you say light, tight, dynamite?
Light, tight, dynamite.
So after doing all those, I've seen his soft palate and uvula rise. He was able to say light, tight, dynamite. And that tells us that cranial nerves number 10, 9, and 12 are intact. This would conclude my assessment for today. I would ask Martin if he has any questions for me. And then that's it.